So let's talk about irregular cycles. What causes them, who has them, and why are they important in fertility? So when women have regular cycles, it usually means they're releasing an egg every month. But when you have an irregular cycle, it's usually fairly unpredictable when you're releasing an egg, and that means we don't know when's the right time to get pregnant. It's a problem that affects a lot of people. We call it anovulation or oligo-ovulation when somebody is not ovulating or is ovulating very infrequently. There are different people that this can affect for different reasons. Some women are younger and have ovulation issues because their brain and their ovary are not doing a good job of communicating with each other. Sometimes you'll hear about that called polycystic ovary syndrome. And sometimes there can be other factors like thyroid or other hormones that can cause you to have irregular cycles. Some people that have excess amounts of activity and are competitive athletes who don't maybe have the right brain and ovary communication going on, it makes their bodies struggle to develop an egg on time, and that's another reason you can have oligo or anovulation. Finally, as our ovaries get more mature and they struggle a little bit more to make eggs, it can be very unpredictable to know when that egg is finally ready to come out and be developed. And the brain has to work harder to get those eggs and ovaries to respond. That's called diminished ovarian reserve or ovulatory dysfunction relating to ovarian aging. All of these things can be really simply diagnosed, usually through blood work or ultrasounds, so that we can figure out the reason why you're not having regular cycles, and usually the medications that we would use to help coordinate those signals to get ovulation back on track. One of the questions I often get is how somebody can optimize their own natural fertility, right? And one of the first things I try to tell people is that their lifestyle is not the reason that they have infertility. Fertility is not a lifestyle choice. You're not doing something wrong that makes this a problem. This is a medical diagnosis. But with that being said, in addition to our medical treatments, there are things that you can do to help optimize your own natural fertility. We encourage all patients to take some kind of prenatal or multivitamin, something to make sure you've got the right amino acids, micronutrients, things that are going to help support an ongoing pregnancy, especially something with folic acid. I tell my patients to make sure they stay away from vices that really none of us should have, right? Smoking, alcohol consumption beyond a moderate amount each week, and any illegal drug use, of course, is not going to be good for an ongoing pregnancy. In fact, smoking is one of the biggest modifiable issues that can cause problems with both diminished ovarian reserve as well as sperm function. So if our patients are smoking, we know that there are lots of strategies out there to help them break that habit and get into a better place when it comes to their fertility. Caffeine is okay to drink in moderation. That's really important when we've got a lot of other hormones going on. Sometimes we all just need that cup of coffee, and staying with a modest 1 to 2 cups of coffee or beverage a day is totally fine to take during the fertility process.